So this is video number 3 of which patient you are going to see first, right? So during your Nclex exam, you will see a lot of question like this, which patient you're gonna see first. So we're gonna solve 7 more practice question. And if you haven't watched the 2 previous videos, please make sure you watch it. And we're gonna use the same technique above. We're gonna use airway breathing circulation. We're gonna use acute versus chronic. We're gonna use expected versus unexpected, right? So above category, we're gonna find our right answer. So let's do first question. Which patient do you assess first? A, B, C, D. So check which option has ABC problem first. Is there any on ABC? So option B is going to be your correct answer, right? Post thyroidectomy audible stridor. That's mean they remove the thyroid, so they say stridor. That's mean airway breathing problem is happening. Airway and breathing is compromised. So that would be your correct answer. Try to eliminate with the category. Is it option has ABC problem? Yes, there is a ABC problem, right? So B option has ABC problem. ABC always take priority. Option A, post hip replace reporting pain 9/10, that is stable patient, right? Option C, insulin shaky 62. So 62 sugar is patient is still stable, right? Foley catheter is not draining bladder distension. You just have to change the Foley catheter. Maybe it's dislodge or blockade. They say blockage, right? So anyways, priority is your ABC. Move on to next question. A nurse is caring for 4 patients. Which patient should the nurse see first? So out of this, which patient is going to see by the nurse first? So pause the video and try to solve yourself with me same time, right? So let's see if any option has ABC problem. Patient with fever and sore throat, that is stable patient, right? Patient with chest pain and shortness of breath. So see, chest pain and shortness of breath. Chest pain means there is a circulation problem and same time it has shortness of breath. So ABC problem. So immediately that would be your right answer, right? Patient with fracture pain, that is stable patient. With vomiting and diarrhea, stable patient. So airway breathing always priority. Move on to question number 3. The nurse is planning care for 4 patients on surgical unit. Which patient should be assessed first? So a 55-year-old type 2 diabetes, blood glucose reading 190. So type 2 diabetes, this is stable patient, right? Option B, 72-year-old pneumonia who has temperature and is receiving IV antibiotic. So patient who has pneumonia receiving IV antibiotic, that is expected, right? Option 3, 68-year-old 2 days post knee replacement who is reporting sudden shortness of breath and chest pain. So that would be your correct answer immediately. Sudden shortness of breath and chest pain means they say acute problem, right? Acute versus chronic. So you're gonna choose option C is your right answer. Question number 4. Next question. A nurse on surgical unit is caring for 4 post-operative patient, right? Which patient should the nurse see first? Okay, A, B, C, D. Patient who is post-op 1 day following carotid endarterectomy, now reporting new onset hoarseness and so see, the clues will tell you now, right? Now means there is sudden changes. So sudden means acute problem, acute versus chronic category, right? So acute means something just started newly, new onset of hoarseness and difficulty swelling. That's a airway breathing compromise problem. So that would be your correct answer immediately. You don't have to look other option. Next question is, a nurse is caring for 4 patients. Which patient should the nurse assess first? A patient with COPD who has oxygen sat 89. COPD patient will have always around 89 to 90 oxygen. That is stable patient, right? Option B, post-op patient who is reporting pain 8/10 pain, not it's a stable patient. Patient with type 2 diabetes who has blood glucose 240, that is also stable. Patient with pneumonia who is confused and restless. So confused and restless, right? That's the acute problem. That is new to the patient, right? Patient is confused and restless. That would be your correct answer. acute versus chronic. Which patient should the nurse assess first? Patient with temperature of 104, patient with chest pain, patient with constipation, mild headache. Mild headache is stable, patient with constipation stable, patient with chest pain. Chest pain, if you don't do nothing, that's mean patient will develop myocardial infarction, right? So chest pain means there is a circulation problem happening. So that comes under airway breathing circulation problem, right? So ABC category, that would be your right answer. Patient with chest pain, that is a priority to see, because there is a circulation problem happening, there is a blockage, otherwise patient may develop heart attack. You are the nurse on med surg unit. Which patient should you assess first? Patient with pneumonia reporting increased fatigue. Post-op client who is requesting pain medication. Patient with heart failure who gained 5 lab in 24 hours. A diabetic patient with blood glucose to 10. Right. So patient with pneumonia reporting increased fatigue. That is expected, right? Expected versus unexpected. Post-op client who is requesting pain medication. That is stable patient. A patient with heart failure who gained 5 pounds in 24 hours. That is a problem. That is a circulation problem, because in heart failure the patient will develop fluid overload, right? If fluid is getting more and more, it's gonna compress the airway. It's gonna compress the pulmonary lungs, and the patient will start having breathing issue. So that would be your correct answer. Airway breathing circulation problem. So that is your correct answer, right? Last question, which client should the nurse assess first? COPD with O291, that is stable. Asthma client with rescue inhaler more often, expected. Post-op client who post-op client with new restlessness and O2 sat. That is your correct answer immediately. New restlessness and O2 sat 88. New means acute problem, acute versus chronic category, right? So you have to immediately pick this answer. Pneumonia client with productive cough, patient is stable. So see, that's how you have to eliminate. You have to use that technique using ABC, who is expected versus unexpected, chronic versus acute, and who is going to crash first. So based on this, we able to solve all of our 7 problem immediately, right, with a breeze. So we're gonna do more practice question in future, and I hope you're learning and you're getting good foundation. When you see, you're gaining enough confidence when you see this kind of question, right? Before you, when you see this kind of question, you are nervous like which one to pick, but now you are able to get how to crack this answer, right? Right.